Hi everyone, welcome back to Beyond Your Knowledge. Today we're going to be studying Amphotericin B Toxicity. And before we continue, I would like to share with you John 15:12-14, and says that this is my commandment, that you love one another as I loved you. Greater love has no other than this, that someone lay down his life for his friends. You are my friends if you do what I command you. Amen. That was John 15:12-14. Amen. Well, love is the key word. Okay. Now, let's just talk about Amphotericin B toxicity. So this one causes different things. So we're going to first mention that Amphotericin B we give to the patient intravenously. So that means that we give it IV, which is actually should be better, intravenously, which is IV. Okay, now it's more correct. Now we're going to mention different things during the toxicity. Well, the first one that we're going to mention is here. So it is acute infusion related reactions. Okay, so you can cause acute infusion. So when you are putting to the patient infusion related reactions. So what do you think it can cause? Okay, so this is the first one that we're going to see, and well, can cause, for example, fever, can cause chills, okay, can cause rigors. Oops, sorry, this is spelled wrong. Yeah, there we go, rigors. Yes, rigors. Yeah, so rigors, which is so a sudden feeling of cold with shivering and by rising temperature. Well, so often comes with sweating, especially if the onset is a height of a fever. Okay, so so also the patient can get a hypotension. So okay, and these are the most common frequently during the initial infusion, but then it's going to decrease during the subsequent infusions. So the for example, if the patient has fever, so what we should give before? Yes, antipyretic. Okay, so which is antipyretic. Also, we can another to avoid this. So if the patient has any side effects like any that involve histamine, so we can give also antihistamine. Okay, so those are let me just put it here, antihistamines. So I will those recommended if patient get those side effects. Okay, now this is one of those acute infusion related reactions. This is not the only one. So the other so and this the premedication can lessen the severity of the side effects. Well, I mentioned that. So now we're going to see the other, so that can cause, it is called dose dependent nephrotoxicity. Okay, so dose dependent nephrotoxicity. So in the dose dependent nephrotoxicity, this can result from a drug induced decrease in the glomerular filtration rate. So that means that your glomerular filtration rate can decrease. Okay, so the permanent loss of the renal function is thought to be related to the cumulative total dose. So the total dose accumulated can cause well, the side effect. Okay, side effects are areas like that. Let me just put it here that we don't forget. Okay, and yeah, so this is yeah, GFR is a glomerular filtration rate. Okay, and then the other side effects that we can see here with this in the dose dependent, so the renal function, for example, the creatinine. Okay, so the renal function. So what example for this is going to be? Creatinine. So the creatinine should be closely monitored in patients undergoing the treatment with amphotericin B. So we need to monitor this. So just creatinine should be monitored. Sorry, it should, there we go, should be okay. Yeah, so also avoid concomitant administration. So avoid, I will put this in red because avoid concomitant, yeah, so drugs. So concomitant administration, which kind of drug do you think that we should avoid? Yeah, so we need to avoid so a few drugs I'm going to mention. So for example, aminoglycosides. So one more, that is it. I was just going to mention those two, cyclosporin. So yeah, so any drug that is going to decrease also your glomerular filtration rate, and or is going to affect your have a metabolic, the metabolism is in the kidney, so it should be avoided. Okay, so this is the dose dependent nephrotoxicity. But there are a few more, so but it's another one. So now we're going to talk about the electrolyte abnormalities. Okay, so do you remember the electrolytes has a very important role in basically in all our body. So what are going to be in the electrolyte abnormalities? So that can cause, so affect two electrolytes. One is called magnesium and the other is potassium. Okay, so magnesium is going to cause hypomagnesemia, and in the potassium can cause hypokalemia. Okay, so well, this affects according to the patient when. So you see this during the first week usually. Okay, and what we need to do, just monitor to the patient. Okay, but how often we should do monitoring this? Daily. Okay, so monitor it daily. Okay, now we're going to see one more or two more. So one is called anemia. Oops, sorry, anemia is spelled wrong. It's with the so anemia. So anemia can occurs due to what? So due to suppression. So due to suppression of the. So do you remember the cause nephrotoxicity? So in the kidney will also produce erythropoietin. So and then it's going to suppress suppression of this renal erythropoietin. Okay, so now we connect this, and then this leads to anemia. Yeah, erythropoietin synthesis. Okay, so this may be severe in patient with, okay, more severe. In which kind of patient? In patients with HIV. So HIV, which is human immunodeficiency virus, okay, or but exactly those that are taken, I mean more those that are using cytovidin, okay. So cytovidin, which suppress, okay, so suppress, which is should be, sorry, this which is spelled wrong. Yeah, so this cytovidin suppress, yeah, it suppresses the bone marrow. Got it? Okay, yeah, so well, one more side effects here, but it's not anemia. So it's not anemia. Now we're going to see another here, which is thrombophlebitis. Yeah, thrombophlebitis. Yeah, thrombophlebitis. Okay, yeah, bitis. Yeah, thrombophlebitis. So, well, where you can see the basically in the site of the injection. So, yeah, so you see it at the site of the injection. Site of injection. Got it? Yeah. Well, this is all about the Amphotericin B and the side effects and toxicity. So thank you so much for watching. Remember, we can do all things through Christ strengthens us. God bless you.